I'm Dr. Siobhan Dolan, and today we're going to talk about inducing labor. For some women, labor is slow to begin. If this is the case, your healthcare provider may give you medications or use other mechanisms to bring on your labor. Induction is sometimes needed to protect the health of both the mother and the baby, but it also has some risks. Jenny, did any of your friends ever talk to you about scheduling their delivery and going in on a certain day for convenience sake?
Yeah.
I think what happens nowadays is it feels like medicine can take care of everything, so there's really no downside to scheduling. We really want to consider the health benefits to mom and baby. Induction of labor does present some medical risks. First of all, when you use medication to start labor, it can sometimes come on very strong. You need the uterus to contract, but you also need the uterus to relax, because it's during relaxation that blood flow can then flow to the fetus. And so if you're actually what we call hyperstimulated, so much Pitocin that your uterus is almost constantly contracted, your baby can end up not getting enough oxygen. That can cause the heart rate to slow, and then the baby looks like it's in fetal distress.
Mm-hmm. My mom was watching the
contraction monitor.
Monitor on the screen. All of a sudden it was like nothing, and then all of a sudden it stayed up at it didn't go lower than 4 at any time. My mom was saying it was going to 10, and then it was going down to 4, and it didn't cease. It was constant contracting.
How long was the labor then?
Well, they started the Pitocin at noon, and she was born at 6:50.
Good. And she healthy?
She was fine.
For
Yeah,
the moment she came out?
She had the cord was around her neck a little bit, so she had a little bit of problem breathing when she first came out. But then they took her over, and she was fine.
Other complications of induction of labor can include infection, especially if the labor induction takes a very long time. We've all heard stories of women who went in thinking the induction of labor would be very straightforward and end up 2 or 3 days later with an infection, with fetal distress, and then needing a cesarean section. Uterine rupture, it's a rare complication but very serious. Again, if a woman's had a previous cesarean section and has a scar in the uterus, and then that Pitocin medication causes strong contractions, that can be a setup for a uterine rupture. Good monitoring can make an induction of labor safe, even in various medical settings, but you want to be watched very closely.